It will amaze you how broad assessment is, and that's why I'm taking my time to make these videos quite explanatory in different at different posts. Okay, so please take your time in any of the documents you want to see and all of that. Check the previous videos. I'm sure you get the information you need. However, if you don't, please send the message, put in your comments and your questions. All right, before we go on, let me take this time to remind you, if you haven't subscribed to my page or you've not liked, please do like, subscribe. Most of all, please share to the people who you know need this information, the people who you know will be writing their OSCEs. Okay, please do share. Right, thank you ahead of time. Right, so today, what are we looking at? We're still looking at assessment. However, this video concentrates on the pulse and respiration. Okay, and I'll be sharing with us the modification that has happened over the years. All right, so for pulse, which we call the heart rate, normally we check the pulse manually for 1 minute. Okay, and then we also check the respiration for another 1 full minute. Right, so for some of us, we understand some practice. Some people will check 30 seconds and do ×2. You know, all of that doesn't work, please. Okay, especially with regards to your exam. I would encourage you, if your pulse and your respiration is 2 minutes, you need to use the complete 2 minutes. So if you are going to be checking your pulse, you know, you check that for full 60 seconds. What this means is you need to first of all at least locate where you'll be taking your pulse from. Okay, when you check that, you can locate it. Then your eye goes to your time. So some people mention, my time starts now. Why? Because they want the assessor to be aware of their timing. All right. However, please, you need to do a full count. Some people, some test centers will have to use the digital clock, which is at the test center already. And what that means is you might need to be counting down, because the digital clock counts down. What that does is sets the full time. So if your assessment was 20 minutes, it sets 20 minutes for you and begin to count down. And maybe the time when you start your pulse, maybe you're in 16 minutes 55 seconds. So what that means is you have to count down to 16 minutes. From 16 minutes 55 seconds, you have to count down to 15 minutes 55 seconds, 55, 54, very bad. Okay, so that takes away your 60 seconds. That's your 1 full minute. Then to count your respiration, you then need to go from 15:55 to 14:55. This is just taking out your 1 full minute, right? It's helping you count down the 60 seconds. You need to do this accurately. You need to be very accurate when doing this, because we've seen feedbacks from people who have failed assessment just because they didn't count for a full minute. I mean, that's too little a thing for some to fail their assessment and start by saying, I come into my patient room, I check my sensitivity. Oh, please. So please, I'll encourage us, carry out our pulse to it a full minute and the respiration a full minute. Now, I talked about the digital clock, which you would see in the test center. However, I hear some test centers allow people to use the fob watch, which we call the breast watch. Okay, and I'm sure most of us know how to use this, and that's quite easy for people. Okay, so if you know how to use this, you know how to count that one. I mean, it's quite easy. All you just need to do is follow your second hand from wherever it starts to the point where it started. That's 1 full minute. Okay, so you just allow that to go 1 round of 60 seconds, and then they go the second round of 60 seconds, right? So some test centers will provide you this fob watch. Some people may have to go with their own fob watch. Whatever the case may be, please, you need to know how to check for 1 full minute, how to check your respiration for 1 full minute. Again, I would like to point this here, that some people, due to tension and anxiety, they miscalculate their respiration. So we know that a respiratory count is Full rise and fall of the chest is 1 count. Another rise and fall of the chest is 2 counts. Most of us know how to do this. However, when some people get into the exam mode, tension, anxiety, and they begin to miscalculate, please and please try to practice being calm. It's one of the things I do advocate for and say everyone who is going to go through the OSCE exams needs to practice being calm. Okay, that will help your anxiety. At least drop the anxiety level a bit. It may not be totally, but a bit, right? So this video has just covered how are we supposed to take our heart rate, our pulse rate. Again, before I end this video, I want to remind you, your best bet is not to use the pulse rate you get from your Dynamap machine, okay? Please. So the best practice is, once you're starting your observation, before you turn on your Dynamap to use, please make sure you check for pulse and respiration, and then you go down to do your blood pressure, and that is only when your machine comes on. Why am I saying this? Some people tend to do the blood pressure, get the pulse rate from the machine, and then don't count properly. Please, I don't want you to make that error. We need you to do this. And if you go according to your ABCDE, we always encourage you have to immediately you get to your breathing, you do your respiration, and that you do your pulse, and that helps you cover your respiration. All right, so there is no way your blood pressure will come before your pulse. All right, please don't forget that. Don't take the count that you see in the machine for your pulse rate. Use your full counting of 1 minute. Till I come your way again, please watch out for my next video. I'll be giving you loads and loads with regards to your OSCE practice. Remember, we aim for first time pass, okay? So if you haven't liked, if you haven't subscribed, please do like and subscribe to my channel. Most of all, share this video.